Dear colleagues, today I'm going to tell you about gene expression biomarkers in the peripheral blood for postoperative pain prediction prior to knee or hip arthroplasty. Osteoarthritis is a systemic condition that can affect single or multiple joints. It involves degenerative changes in the articular cartilage, remodeling of the subchondral bone, and limited synovial inflammation. Pain in OA is the main clinical symptom that limits patients' working capacity and everyday self-care. Osteoarthritic pain denotes an indication for joint replacement in patients with end-stage osteoarthritis. However, chronic postoperative pain is observed in 10 to 40% of patients with osteoarthritis. Putative causes for the postoperative pain persistence are a predominance of central sensitization in 30% of patients with osteoarthritis, dysfunction in the descending pain modulatory system, and an altered expression of genes associated with neuropathic pain, such as cathepsin S, caspase 6, metalloproteinases 9 and 2, and tissue inhibitor of metalloproteinases TIMP. Putative predictors of postoperative chronic pain are patients' socio-demographic and clinical factors such as female gender, older age, high levels of baseline pain, psychological factors such as depression and anxiety, and various metabolic disorders like high body mass index, obesity, inflammation, comorbidities, and osteoarthritis of other joints. However, putative prognostic factors fail to predict the postoperative pain unequivocally. Therefore, recently several molecular markers associated with postoperative chronic pain were identified. For instance, high protein concentration of tumor necrosis factor, matrix metalloproteinase 13 and interleukin 6 in the synovial fluid of end-stage OA patients were identified as independent predictors of postoperative pain 2 years after arthroplasty. However, synovial fluid is not always an easy accessible tissue. Therefore, specific aim-1 of our study was to identify genes whose expressions in the peripheral blood before knee arthroplasty could be associated with the post-surgical pain development in patients with end-stage osteoarthritis. We used the following methods. We monitored the visual analog scale index, brief pain inventory questionnaire to assess the severity of pain, the hospital anxiety and depression scale questionnaire, and then foreign pain detect questionnaires were used to assess neuropathic pain. The Western Ontario and McMaster University osteoarthritis index WOMAC was used for functional activity assessment. 6 months after surgery, pain indices according to VAS of 30% and higher were considered. Protein levels were quantified by ELISA. Total RNA was isolated from whole blood, and quantitative gene expression assessment by real-time RT-PCR was performed for caspase 3, matrix metalloproteinase 9, tissue inhibitor of metalloproteinase 1, cathepsins K and S, tumor necrosis factor alpha, interleukin 1 beta, and cyclooxygenase 2 were assessed. The study group consisted of 50 patients with end-stage OA of the knee who underwent total knee replacement surgery with average age of 67.6 years. The control group consisted of 26 subjects with average age 65.8 years who were free from any serious diseases. 17 patients reported post-surgical pain 6 months after surgery. At the same time, both examined subsets of patients with OA revealed essentially similar baseline levels for the majority of indices. Only patients who developed post-surgical pain had more often arterial hypertension. Gene expression of cathepsin K and S, caspase-3, TIMP1, IL-1 beta, and TNF-alpha measured in the peripheral blood before surgery was significantly higher in these 17 patients compared to 33 pain-free patients with osteoarthritis, while MMP9 and COX-2 gene expression was not significantly different in both subsets. The protein levels of TIMP1 in patients with OA who developed post-surgical pain were significantly higher compared to pain-free subjects before surgery, while MMP9 protein concentrations were not significantly different between the examined subsets, and confirm our gene expression studies. A row curve analysis confirmed significant associations between expressions of the identified genes in the peripheral blood before surgery with the likelihood of pain development after surgery. The cutoff values and the hooks you can see on the right side of this slide. Therefore, high baseline expression of genes associated with extracellular matrix degradation, cathepsins S and K and TIMP1, inflammation, IL-1 beta and TNF-alpha, and apoptosis, caspase-3, measured in the peripheral blood of patients with end-stage osteoarthritis before knee replacement surgery, might serve as an important biomarker of postoperative pain development. Recently, significant differences between hip and knee osteoarthritis were identified, although previously knee and hip osteoarthritis were considered to be the same disease. These differences were observed in pathophysiology, primarily differences in inflammatory processes measured in serum and synovium. The distinct serum cytokines were differentially expressed between people with hip and knee osteoarthritis, namely higher concentrations of IL-4, IL-10, TNF-alpha were found in synovial membrane from hip osteoarthritis compared to knee osteoarthritis. And high serum concentration of pain biomarker COMP was associated with hip-related symptoms, but not with knee-related symptoms. In addition, differences were observed in long-term prognosis. A shorter window of opportunity for non-surgical treatments due to early joint replacement in patients with hip osteoarthritis was noted. Younger males with lower body mass index more often undergo hip replacement, and greater patient satisfaction with hip replacement compared with knee replacement was observed. However, also greater revision burden for hip replacement was also noted. Therefore, the second specific aim was to identify genes whose expressions in the peripheral blood before hip arthroplasty could be associated with the post-surgical pain development in patients with end-stage osteoarthritis. The study group consisted of 31 patients with end-stage OA of the hip who underwent total hip replacement surgery, average age 61.3 years. The control group consisted of 26 subjects, average age 63.8 years, who were free from any serious diseases. 12 patients reported post-surgical pain 6 months after surgery. Both examined subsets of patients with OA revealed essentially similar baseline levels for the majority of indices, while patients who developed post-surgical pain had higher body mass index and neuropathic pain score according to DN4 questionnaire. Gene expression of cathepsin S measured in the peripheral blood before surgery was significantly higher in these 12 patients compared to 19 pain-free subjects with osteoarthritis, while IL-1 beta, TNF-alpha, and COX-2 gene expression was not significantly different in both subsets. The protein levels of cathepsin S in the patients with hip osteoarthritis who developed post-surgical pain were significantly higher compared to pain-free subjects before surgery, confirming our gene expression results. ROC curve analysis confirmed significant association between expression of cathepsin S gene in the peripheral blood before surgery with the likelihood of pain development after surgery, with cutoff value of 569 and AUX 0.741. Therefore, high baseline expression of cathepsin S gene measured in the peripheral blood of patients with end-stage OA before hip replacement surgery might serve as an important biomarker of postoperative pain development, while baseline expression of pro-inflammatory cytokines IL-1 beta and TNF-alpha and COX-2 were not informative biomarkers related to postoperative pain development. Conclusions. High prognostic value of baseline cathepsin S gene expression in the peripheral blood in patients with hip and knee osteoarthritis indicates versatility of this biomarker in relation to surgery outcome expectations. Baseline pro-inflammatory cytokines, TNF-alpha and IL-1 beta gene expressions have prognostic value for postoperative pain development only in case of patients with knee osteoarthritis. And baseline neuropathic pain scores have higher importance as prognostic biomarkers for postoperative pain development only in case of patients with hip osteoarthritis. Thank you for your attention.